been asking so many questions why it's been impossible for them to conceive or to impregnate a woman. This evening we are going to be looking at what could be the possible reasons behind men and women living for over 20, 30 years without conceiving and giving birth to a child, be it a boy or girl. This evening we are going to be guested by someone who has been helping so many persons in the domain. He's going to be explaining to us what infertility is all about. Good evening, televiewers. You're welcome to Prime Hour on My Media Prime TV. I am Kum Leonard. We're going to be discussing on this very important topic. The first for this week with Dr. Oben, who previously has been here, and we had a discussion on this topic, but so many of you persons have been writing over the months requesting that he comes back to clarify us. So if you're watching this program, wherever you are, if you have a brother, a sister, an aunt or an uncle, a friend who has been finding it difficult to conceive, asking why, it's been maybe accusing brothers and sisters in the village, aunties or uncles, it's time for you to call them so that they can get educated on the reasons why they have been infertile for so long. Dr. Oben, we are glad to have you once again on Prime Hour on My Media Prime TV.
Thank you, Mr. Leo, and good evening to all the televiewers of My Media Prime TV. It's always a privilege when we are being called on air to help educate the population on fertility and reproductive health challenges.
It is a silent struggle, and so many persons are living with it, difficult to accept, seemingly presenting happiness, or portraying some sort of happiness both for the man and the woman. For many cases, there is a struggle that takes people from one medicine man to the next, from one doctor to the next, from one church to the next.
Yes, it's, the topic itself is very captivating. So many couples, they face silent challenges, and at times they, for fear of being stigmatized, they tend not to open up, and so they tend to seek alternative sources to be able to probably have the cry of a baby in their house. So that's why today we are out, so that we'll be able to, throw more light on what is infertility and how we can go about to navigate the treatment, both in men and in women.
But many silent cries in many rooms, across many homes in Cameroon.
Yes, so many, not just in Cameroon, across the globe.
Across the world, yeah.
But you realize that the silent cries are beginning to be increasing, probably due to some factors that we'll get to explain during the course of the program.
Could you describe what families are living? A typical lady who has not had a child for, say, 5, 6, 7 years.
Well, it's actually challenging, for a lady who got married probably 2010, and this is 2014, probably the child should be somewhat 14 years or 13 and probably be in secondary school. We realize that the lady is still hoping on God, and at times it's complicated by the nature of the family members. Probably when they send the child, they will say, "Oh, no, send my picking, go born your own." So you realize there's a lot of emotional stress attached to it. So these women tend to wet their pillows every night, believing God that God will one day give them a miracle.
That God will one day give them a miracle, but we have had so many of these women moving from one church to the next, and moving from one doctor to the next, moving from one traditional doctor to the next, not knowing what to do.
Yes, that's why we, as a fertility expert, I always advise women, generally those trying to conceive, both men and women, to have a holistic approach, because you realize that most cases that they usually go to the pastors is something that can be handled in the hospital, or if they went to the hospital at very early stages, it's something that would have been handled and their infertility would have been reversed. But you realize that because of the the stereotype mindset that some people have, or maybe because of ignorance and negligence, they tend to visit native doctors, they tend to spend all their monies going from one church to another, attending multiple crusades, and before they come to the hospital, it's already the chronic stage. Let's say a lady who probably started trying to conceive at the age of 25, and she has been visiting one church to another, visiting native doctors, and now she finally made up her mind to visit hospitals at the age of 42. At that point, there's little or nothing that can be done. We're now hoping for miracles. In as much as there are other options available, but they are relatively expensive. So you realize that due to the poor health behavior of Cameroonians, they tend to complicate the issues surrounding infertility, most especially.
The tendency is for persons to believe that infertility is always in women and not necessarily in men.
Yes, and in fact, I'm struggling to have, if I can have a platform where I have just men to talk to them that, listen, infertility is not just the issue of women. It affects, in fact, for the past 8 months, the couples I've received, I realized that more than 60% of the cases of infertility are from the men. And they were like, wow, I didn't know. Because they grew up believing that just women suffer from infertility. No. Men have a lot of infertility problems at times, and they tend to stigmatize the women. Probably because in their past relationship, they once had a child before meeting their present partner. So they now believe that once fertile, always fertile. No, that's not the case. Men also suffer from infertility. In fact, men are more increasingly suffering from infertility than women, because the women themselves are more conscious. When a woman is trying to conceive 1 year, 2 years, it doesn't go, the next thing she struggles to go to the hospital. But the men believe that it's just the issue of the woman. So dear men watching us out there, infertility affects both men and women. So therefore, if as a couple you guys are trying to conceive, do not hamper the blame, do not hang the blame on your wife. Please seek the services of a fertility expert, so together we can do a holistic and integrated approach to look for where the possible problem is. And if we've seen where the problem is, then we'll give you a holistic solution to the problem of infertility.
So if you're watching the program, maybe your aunt, your sister, your brother, your uncle has not been able to either impregnate a lady or to conceive a child as a woman, it is time to call them, get them connected to My Media Prime TV as we speak, so that they can get the lessons. Let us look at primary and secondary infertility. What's the difference?
Now, when we're talking about primary infertility, it simply means a woman who has never been pregnant, or a man who has never gotten a woman pregnant. Because most of the times, they always tend to say, oh, it's just the woman. No. Primary infertility means for a period of 1 year, the woman has been having regular, constant, unprotected sex, and she's not able to get pregnant. And the man has been having regular, constant, unprotected sex for 1 year, and is unable to get the woman pregnant. She has never been pregnant. The woman has never impregnated the woman. That is primary infertility. But when we're talking about secondary infertility, it means that this woman has been pregnant before, but probably due to some medical factors or due to some genetic factors or all other health-related complications, this couple are finding it difficult to conceive. So that's secondary infertility.
Okay. What could be responsible for a man to impregnate a lady and later on is unable to get a second or third child? And same for the woman. I have conceived, I have given birth, but difficult to take in a second.
Now, you realize that it has a lot of factors. One, you have lifestyle factors, you have health-related factors. For example, probably this man once had a relationship and has a child, probably the child is 2-3 years, and probably breaks up and now settles down and gets married. But along the line, this man probably had an infection like chlamydia. Along the line, this man became a heavy smoker. Along the line, this man became consumes alcohol excessively. This tends to hinder and negatively affect the man's ability. For example, smoking. You realize that it's a more common trend among men, among the youths even, to go to clubs and smoke what they generally call shisha, because they believe that it has less effect than cigarette. No. But scientifically, he realized that shisha causes reduce in viscosity of the sperms. Now, when we're talking about viscosity, we're talking about how thick the sperm should be. Sperms are not supposed to be too thick. They're not supposed to be too watery. They have a particular viscosity they are supposed to be. So this man probably had a child, but the lifestyle after having this child became something which is not good in the eyes of the medical perspective. You realize that this man will suffer from infertility, secondary infertility. Even the woman herself, probably the woman later on developed ovarian cysts. Maybe this woman, after having the first child, later on developed uterine fibroids. Or maybe this woman had excessive weight gain, because it should be noted that excessive weight gain most of the times contributes to secondary infertility. If you look at most women who present with infertility, after checking their body mass index, you realize that they are suffering from weight gain, which negatively affects infertility. So those are some of the factors that come together to contribute to secondary infertility.
Okay. Those of you who are watching and you have some questions to ask, just send them to me and I'll put them through to him. But Dr. Oben's number is also on the screen. You could ask him directly what you want to know. Mr. Leo, good evening. Please ask our doctor, how about the case that is more than the hospital, but we see men of God doing miracles and we see the results? Thanks, Mr. Elvis.
Now, when you say more than the hospital, you have to be specific, because doctors believe, that's why we call it the holistic approach. Mm-hmm. Now, as an expert in natural reproductive and infertility medicine, we believe in the holistic approach to manage infertility, which means we look at the both physical, mental, and even the spiritual aspects of it. Now, we have unexplained and idiopathic infertility. If we have been able to harness all of this and realize that probably you're having either idiopathic or unexplained infertility, we're going to go to the next approach, which is the spiritual. Because you realize that health is the physical, mental, social, and the spiritual well-being of an individual. So you realize that the spiritual component is even the last. So some doctors, even personally, we even work with some pastors, like this case has all medical definitions, cannot be able to trace what is the cause of this infertility. So, madam, so sir, please, maybe you can seek for divine intervention. That is when a miracle comes into place. But God did not actually create babies, to the aspect of trying to reproduce to be in the form of miracles. Miracles only come into place when all aspects of medical science are failed.
Okay. Now, infertility, you talked about the case for the causes of infertility. Generally speaking, many persons would want to know what would cause a man who was formed in God's image not to be fertile. The same for the woman, because God said, I am sending you guys to go multiply.
Now, Mr. Leo, you understand that reproduction has a lot to do, apart from, what God has said, but you understand that it takes two to able to bring a child. Mm-hmm. Now, genetics can actually stop a man from being able to impregnate a woman. Men who are born with micro penis, which mm-hmm. means the hormones responsible for secondary sexual characteristics in the man, they were limited or absent in that man. And that is genetic. You cannot question why it happened. This man was born from birth, and the hormones responsible for development of secondary sexual characteristics, for example, for the man, you have developing of, beards on the chin, deepening of the voice, enlargement of the penis, and hair on the pubic areas. Due to some genetic mutations, these hormones fail to appear, or they are there but present in limited amounts. So if this person is having a genetic mutation at the level of hormones, let's say this person is having reduced production of testosterone, you realize that you tend to affect the man's infertility, because one, this man will have reduced libido, which is sexual desire. And if a man has reduced sexual desire, it's generally going to affect his ability to get the woman pregnant, because the man will generally lose appetite in sexual activities.
Yeah, but generally speaking, what will cause, I want us to look at the different causes, yes, in women.
All right. Now, in women, we have a variety of causes. Now, you have conditions like polycystic ovarian syndrome, which means this woman has developed an increased number of cysts within the ovaries. It can be unilateral, which means unilateral means it's just one side of the ovaries, maybe the left ovaries, or it can be bilateral, which means both ovaries have cysts in it. And now, when these cysts are present at the level of the ovaries, be it the left or the right ovaries, they cause irregular periods. And if your periods are not regular, you find it difficult to even track your ovulation, thereby leading to either primary or secondary infertility. Another aspect is weight gain. A lot of women think that being chubby is actually a good sign of living. It is, but it affects your ability to conceive if at the end of the day your body mass index is greater than 30 kilograms per meter square. So weight gain causes reduction in insulin sensitivity, and when this happens, most of those women tend to have hormonal imbalance, and hormonal imbalance affects the woman's ability to conceive. Another factor involved is uterine fibroids, what they commonly call growths. Now, the presence of these fibroids or this growth within the endometrium prevents implantation to take place. 2, it causes irregular periods. 3, it causes hormonal imbalance. And when these factors come into place, you realize that this woman finds it very, very difficult to conceive. And another major factor is what we call anovulation. Anovulation means absence of ovulation. Now, ovulation is that period in the reproductive health of a woman where unprotected sex can lead to pregnancy. Let me tell you, realize that, like the other day I was telling a group of women, I said, you can menstruate without ovulating. And they were like, how does that happen? Ovulation is the release of a matured egg to be fertilized, to be potentially fertilized by the sperms of the man. But if that egg has not been released, probably due to hormonal imbalance, probably due to polycystic ovarian syndrome, probably due to ovarian cyst, you realize that if the egg is not there, the sperms will just come and they die within their stipulated period, and the woman keeps trying and trying and trying and trying and trying. Now you have stress, you have emotional factors. All these factors come together to cause the woman to suffer either from primary infertility or secondary infertility.
Okay. Fallopian tube blockage. How does that obtain?
Yes, fallopian tube blockage is I was discussing the other day with my mentor, one of the very senior fertility specialist, Dr. Eugene, and we were asking if we could find ways in which we actually look for a remedy for fallopian tube blockage, because we realize that it is becoming very common when young girls are trying to conceive and you send them to go do a hysterosapinography where the pictures of the fallopian tubes are being snapped to check if the tubes are patterned, which means if the tubes are open or if there's any adhesions. And then you realize that most of those women come and you realize that most of them have either unilateral or bilateral tubal blockage. And it's a very major concern in reproductive health because that's one of the leading causes of infertility. If it happens that it's unilateral, which means the other fallopian tube is open, then you have hopes that, okay, the other fallopian tube can be able to take over the function of the other. But if it's bilateral and probably this woman does not have money to go in for surgery because most of the surgeries are relatively expensive. So an average Cameroonian who probably selling vegetables in Munya market, who is hawking in my 16 market, cannot be able to afford those surgeries. You realize that fallopian tube blockage or fallopian tube adhesions, or what we call sapingitis, which is inflammation of the fallopian tubes due to infection, poses a major threat in fertility, be it secondary or primary infertility.
Okay. Somebody is asking, good evening, Mr. Leo. Is David writing from Kumba? He wants to know, I wish to ask, what causes miscarriage after 4 years of birth?
Now, if Mr. David, if I get your question, which means this woman had a child which is 4 years old and gets pregnant and has a miscarriage. Now, miscarriage has so many factors, all right? So many factors. Firstly, we need to check for rhesus incompatibility, which means we need to know the blood group of the woman and the blood group of the man. Now, if it happens that the mother is rhesus negative and the father is rhesus positive, during the first pregnancy, there will be no miscarriage because there is no sensitivity yet. But now, subsequent pregnancies, there is cross sensitivity, which means if the pregnancy also is a negative, rhesus negative child, this woman is bound to have a miscarriage unless in the previous pregnancy an injection, an anti-rheogram, which we call anti-D, was given to prevent the sensitization. Also, factors that can cause miscarriage, especially the first trimester, the first 3 months, you have stress, anxiety. Most women probably after trying to conceive again for 4 years and she realizes that she's pregnant, she becomes too anxious, too excited. It can lead to stress. Another important factor, especially if it happens at the first trimester, is malaria in pregnancy. That is why immediately you discover that you're pregnant, probably you have done a home pregnancy test and you discover that you're pregnant, you go to the hospital and there's what they call a clinical pregnancy has been confirmed. A clinical pregnancy is confirmed with a blood pregnancy test and also confirmed with an obstetric ultrasound where the sonographer says, Madam, you are 6 weeks or plus 7 weeks pregnant. Now, when that is done, immediately you see the doctor to start follow-up. But you realize that most women, they wait until 4 months, 5 months before they come for follow-up. And probably they already had malaria before even getting pregnant. And during pregnancy, the blood viscosity reduces, probably because the woman is sharing the blood, maybe one fetus or 2 fetuses. So the viscosity reduces. And when the viscosity reduces, they are prone to a lot of infections. So malaria in pregnancy is one of the leading causes of miscarriages. Another factor, if the miscarriage happened greater than 3 months, is what they call cervical incompetence. Now, cervical incompetence means the cervix is the gateway. All right, the cervix is the gateway. Now, the cervix is like this. If the cervix opens and the woman is pregnant at 9 months, if the fetus passes, if the cervix opens, the woman is able to menstruate. If the cervix is open during ovulation, sperms are able to pass through. But now, the way God designed it in such a way that immediately the woman gets pregnant, the cervix closes. And you always start preparing to open when the woman is 10. But due to some factors, the cervix might decide to open when it is not yet time. They call it cervical incompetency. The cervix decides to open probably at 4 months or 5 months. So what is done is that the gynecologist places what they call a spherical suture where he sews up, let me use the word, and closes the cervix. And until when that woman is probably towards term, and he now goes and removes the stitches so that even if the baby comes out at that time, the baby is fit to survive. And also have decrease in progesterone. Now, progesterone is a hormone needed to maintain pregnancy. So, due to one reason or the other, hormonal imbalance, this hormone might tend to decline. And if this hormone declines, especially in the first trimester, you realize that this woman will have a miscarriage. So, those are the various factors and other health complications even that can trigger a woman to have a miscarriage.
Okay, what are the strategies, what can a man and woman do to have a twin? Can we decide on whether we want to have a twin or not?
Yes. Now, twin pregnancy is medically possible.
Okay.
Yes. First thing first, we need to ascertain that the man has a normal semen function. 1, you have to ensure that the sperm count is greater than 15 million sperm cells per mil. 2, you have normal morphology. 3, the viability of the sperms, the motility of the sperms. When that is done, you now go and see your fertility specialist. There's a procedure we call hyper-ovarian stimulation, which means you stimulate the ovaries to release 1 or more eggs. And before that is done, you prepare the uterus, you prepare the uterine lining to increase what we call endometrial receptivity. And endometrial receptivity is prepared through acupressure massage for fertility. So those are some of the things that need to be put into place for you to increase the chance of you having twin.
Okay. Last time I remember we discussed about deciding on the sex of the baby. We have persons who go up to having 8 boys because they're looking for a girl, and you have some who go up to having 8 girls because they're looking for a boy. Meanwhile, if they were to consult someone like you, an expert in fertility, through your intervention, they could decide when to have a boy or a girl.
Yes, Mr. Leo, sex determination is 78% possible.
Okay.
Very, very possible. But the major problem is that the men don't pay attention to the reproductive health of the woman. Now, if you ask some of those men who are even asking about twins, ask them to tell you about the menstrual cycle of their woman. They do not know. The only thing they know is that she's on a period, and after that, they're only praying for the period to end so that they resume sexual activity. So for you to be able to do sex determination, first you need to master the menstrual cycle of your woman. You need to know if she has a very short menstrual cycle of 7 days, or she has the longest menstrual cycle, which is 35 days. Because their predicted ovulation days are not the same. For example, a woman who has a 28 days menstrual cycle, her predicted ovulation day is on the 14th. Okay? A woman who has 21-day menstrual cycle, her predicted ovulation day is on the 7th. Which means if this woman started seeing her period on the 1st of November, by the 7th of November toward the 10th of November, she's already ovulating. But now, if the man has not mastered the menstrual cycle of the woman, he's just interested in probably having a boy child, and he's only hoping on nature, you realize that it's 78% possible, which means we have approximately just 22% left for nature to decide. So the men, I'm encouraging the men out there, please take out time to study the menstrual cycle of your partners. Or why not visit the services of a fertility expert, pay for consultation, and we sit down, we take our time to draft the menstrual cycle of your woman. Tell you, listen, if you're having a 28-day cycle, your predicted ovulation day is on day 14. Now, the male sperms swim faster than the female, but the male sperms don't have resistance. So they tend to die faster. That's why there's an increased female population all over the world. But if you want to do what they call sex timing to determine the gender that you want, you're having a 28 days menstrual cycle, and the predicted ovulation day is on the 14th. If you desire a male child, for example, you meet with your partner on the 13th and the 14th itself. Now, when you meet on the 13th and the egg is released on the 14th, you realize that the male sperms are already ahead because they swim very fast. Remember we said the male sperm, they swim very fast, but they have low resistance. But if you meet on the 13th and on the 14th day, the egg has been released, pop, you realize that the male sperms quickly fertilize the egg. But for those who are too busy and you just come and meet the woman on the 10th and you go, before the 14th day, 75% or 80% of all the male sperms are already dead because they swim very fast, but they don't have that ability to resist the cervical mucus and the harsh internal environment from the cervix going up to the uterus, swimming right up to the fallopian tubes. So you realize that most men are very busy. They just meet with their partner probably on the 11th day or on the 10th day, and they go, and they just allow nature to do the work, and that's why nature is mostly selecting but the female children.
Okay. Female children. So many questions, sir. Good evening, please. When you write, tell us where you're writing from and possibly your name. Good evening, Mr. Leo. Very educative program you have there. Please kindly ask the doctor if high prolactin can cause a woman not to get pregnant. What is prolactin in the first place? Yes.
Prolactin is that hormone needed for, it stimulates the breast to produce breast milk. Mm-hmm. Now, naturally, prolactin levels tend to increase in a pregnant state, and they tend to be more higher when the woman has put to bed, so that when the child places the mouth on the nipples, the reflex causes the milk ducts to release breast milk. Mm-hmm. But in a non-pregnant state, when prolactin levels become high, medically we call it hyperprolactinemia. Now, when prolactin levels are high, is one of the things we call hormonal imbalance. This hormone negatively affects the other hormones. And that's why majority of girls or women suffering from high prolactin levels, one, they tend to have what we call amenorrhea, absence of menstruation when they are not pregnant. So when you go to the hospital and your gynecologist or your fertility doctor says you have high prolactin levels, how does it affect fertility? Prolactin levels now, since the levels are higher than normal, it hinders the other hormones, for example, estrogen, from carrying out its functions. So when that happens, one, the woman does not menstruate. And if the woman does not menstruate, there's no ovulation. And if there's no ovulation, there is no pregnancy. Now, this now boils down to infertility.
Okay. Good evening, Dr. Oben. What can be the cause of a man's certain loss of appetite for sex despite all the romance and love he has for a woman?
Now, decrease in sexual desire can be due to post-traumatic stress disorder, probably due to previous experiences. It can be due to stress. Probably the man is thinking of bills. Probably the man is thinking of, or probably the man is still thinking of a previous relationship that dealt with him, almost took his life. And so the man is still finding out time to heal. But if you are suffering from low sexual drive, your partner stimulating you is not enough. Come to the hospital. First, we need to check your sugar levels. Yes, we need to check your sugar levels. If you check your sugar levels and realize that there is high, we bring them down. And also do some hormonal tests. It could be that you are having low testosterone levels. Yes, if your testosterone levels are low, your sexual drive is automatically reduced. And when that happens, no matter how much you are touched, there is either nothing or there's just little sexual appetite that you can have. So see a fertility specialist, see your doctor to be able to review what is causing the low sexual drive, and appropriate treatment will be given to you.
Now, good evening, Mr. Leo. I am Julius, writing from Limbe. I like your program. Please, I want to ask the doctor. I have impregnated my woman 2 times, but she always ends up miscarrying. The last one was 6 months. What can really be the problem? Because even before I met her, the girl I was dating also had a miscarriage for me, 4 months.
Now, take your partner to the hospital. Someone asked a similar question. The problem is not from you. The miscarriage is not from you, because you have the ability to get the woman pregnant. But now the woman is suffering from inability to maintain and sustain the pregnancy to full term. Like we made mention, if it's greater than 4 months, which is the second trimester, factors that can be responsible for such miscarriages. We have anemia in pregnancy. The woman's blood level reduces, and so our body decides that for this woman to die, let the baby die. It's an automatic reaction that happens in the body. 2, we have malaria in pregnancy. I made mention of that. 3, one of the key factors is cervical incompetence. I said the cervix is the gateway into the womb. If the cervix opens up before time, the woman is tend to have a miscarriage. So go and see your doctor, see your fertility doctor, see your gynecologist, to be able to have a holistic review of where the problem is coming from, and you realize that the next pregnancy you're going to carry it to term.
Good evening, sir. It's Mr. Ayuk, writing from Yaoundé. Please ask the doctor that my wife have had miscarriages twice within a year, and the last medical report shows that she was having blighted pregnancy, which couldn't succeed under any circumstance. Please, I wish to ask what might be the cause of it, and what are the possible remedies to curb any such occurrence.
Now, blighted ovum simply means there was fertilization, there was implantation, but there was failure of development of an embryo within the fertilized egg. They call it blighted, which means the ovum is empty, there is nothing growing inside. And now, it's not from you, it's not from the woman. At times, it's genetic makeup, or it just happens that there's failure of implantation. Now, what you have to do is that this woman needs a comprehensive review. Before she got pregnant, how were her hormones? Before she got pregnant, what was the nature of her uterus? Okay, when this happens, you realize that possibility of her having a blighted ovum will be reduced. But as a woman, you cannot actually stop them from having a blighted ovum, because it's not by our making, it's not by our own making, it's due to hormonal activity. So if she has once had a blighted ovum, take her back to the doctor who handled the case to have a proper review, and the next pregnancy it might not happen again.
Okay. Good evening, Mr. Liu, and to the doctor. I have a son of almost 2 years, and I've been trying to conceive for about 6 months now, but to no avail. I remember before conceiving my first child, I used to have fever, chills, and rigor every night. I later on took some traditional herbs, some turmeric, cloves, ginger, and garlic, and that same month I got pregnant, but I got diagnosed with a PID, PID, during the first scan, of which the doctor prescribed some antibiotics. My question is, could it be an infection that's preventing me from conceiving again? Please, I have normal cycle of 28 days, and I do ovulate as well, because I see the signs. Maria is writing from the Kumba.
Now, you could have all the signs of ovulation and you have a regular cycle, but if there is something hindering you from conceiving, for example, PID, pelvic inflammatory disease, you will find it difficult to conceive unless that particular problem has been handled. So therefore, the simple solution is you see a gynecologist, see a fertility doctor. One will run you an STI profile to be sure that within the past, since you had your child and to now that you're trying to conceive, there is no infection, for example, like chlamydia, like syphilis. There is no infection. And also, you do either a transvaginal ultrasound or a pelvic ultrasound to rule out PID, to rule out any uterine adhesions, to rule out ovarian cysts, to rule out uterine myomas. Those things have to be ruled out before you're able to conceive. And also, you might see the signs of ovulation, but if you actually do a blood test, you realize that ovulation test is negative. So go to the hospital so that it can be handled as soon as possible.
Good evening, Mr. Liu. Can a woman who doesn't ovulate get pregnant?
No, you cannot get pregnant. If the egg is not released, the sperms, what will the sperms fertilize? So that's why I said in the beginning of the program, you can menstruate, but you might not ovulate. But for you to ovulate, you must menstruate.
Okay. Hello, Mr. Liu. I am so grateful and thankful for your guest in the studio. He has opened my brain, even though as a nurse, I'm not a midwife, but has learned a lot from him. Kudos, brother. Keep on. I'm Pankeng Yafe in Bangolan Baptist Health Center. Good evening to you. For always watching and contributing. Good evening, sirs. Please ask doctor what causes placenta previa during pregnancy. Audrey is writing from Omenda.
Now, premature detachment, there's no particular reason why the placenta might decide to detach. Okay, so many factors are responsible. Maybe stress, maybe increase in fetal weight and stuff like that. But it doesn't mean that because you had a placenta previa in this pregnancy, the next pregnancy you're going to have it. It just happened that during the course of that pregnancy, one or two things went wrong within your system and you develop a placenta previa.
Can a woman above 55 years conceive without ovulation?
No, medically no. Now, a woman who is greater than 50 and is seeing her period has decreased chances of conceiving. Why? Because there's a hormone called the anti-mucolytic hormone, abbreviated AMH. Now, this hormone determines the quality of your egg. And by nature, after 35 years of age, you have decrease in your ovarian reserves, decrease in the quantity of eggs that you have. A woman is born with approximately 3,000 eggs. in her system. A woman is born with eggs. It's not like unlike men when they are born and they start the process of sperm production, spermatogenesis start taking place. No. A woman is born with her eggs, a particular number of eggs, approximately 3,000 or more, and every month the eggs are being released. But there's a particular number set by nature. After 35 years, your body will start telling your ovaries that, hey, listen, as you're releasing these eggs, there's a particular number that you have to keep. They call it ovarian reserve. After 35 years, they tend to reduce, and that hormone reduces. And if that hormone reduces, the quality of your eggs reduces. That's why you realize that majority of women who are trying to conceive or face a lot of difficulties to conceive are always greater than 35 years because the quality of their egg has reduced. So even if they meet with a male of 17 years who is at his prime of sexual maturity, it will not even be possible to impregnate them unless they use assisted reproductive techniques.
Okay. Good evening, sirs. Thank you so much for the program. Ernest from Bamenda, please. I wish to ask the doctor what can be the cause of functional ovarian cyst.
Now, we've said ovarian cyst is as a result of hormonal activity within the body of a woman. And can it be prevented? No, it cannot be prevented because as a woman in her reproductive age, at one point in time, you will have ovarian cyst. But now, some are detectable, like they cause symptoms like lower abdominal pains, fever, vomiting, absence of menstruation or irregular menstruation, or you have scanty and spotting periods. These are some of the symptoms that ovarian cyst will cause. But some get dissolved on their own.
Okay, they get dissolved on their own. Let's look at infertility in men. You just made a revelation that is very shocking to me. You see, recently, I don't know, the past 6 months, you've discovered that majority of the cases that you handle show that the men are more infertile than the women, yet the women are being accused in most of our homes. Now, causes, there is this talk about low sperm count, poor motility. What would be, what would account for that?
Now, Mr. Leo, in men generally, when a man comes to the hospital and saying that I'm finding it difficult to get my wife pregnant, the first thing we need to assess is the sperms. Unlike the woman who has a lot of aspects to be assessed. Primarily, we assess the sperms and we check for the sperm count. Now, most men believe that because they have low sperm count, they cannot get their wife pregnant. And I've been saying it on so many platforms that low sperm count alone, emphasis on the word alone, low sperm count alone cannot stop you from getting your wife pregnant. Other factors come into place. For example, if you have white blood cells greater than 1 million per mil in your sperms, you find it difficult to get your wife pregnant. If you consume alcohol excessively, you find it difficult to get your wife pregnant because alcohol affects the morphology. We're talking about the shape of the sperms. Now, if you collect a semen sample and observe under the microscope, you realize that most men have abnormal sperms. Either the sperms have two heads, either the sperms they don't have a head at all, either they have two tails, or they don't have a tail at all. If you even take a sample of the worst is even those who are smoking. I just see a lot of you smoking and probably they are doing it maybe to show off and something. In the next 10 years, we're going to have an increased number of infertility in men. One, because they smoke a lot. Two, they drink excessively. And especially those on drugs, recreational drugs. So you realize that all these factors tend to affect fertility in men. And also, sexually transmitted infections, a main mention of chlamydia, always hamper on chlamydia. Most men, when they are having a sexually transmitted infection, the higher they do is probably they go to the quarters and they buy drugs and they take. And probably the drugs might just subside or suppress the bacteria without actually treating it completely. And most men, they prefer to go spend 20,000 in a beer parlor than taking the 20,000 to the hospital to actually find out the cause of the sexually transmitted infection they are having and actually take proper medical treatment. So, Mr. Leo, you understand that the sperm generally in the men, if you assess the various factors that we mentioned, one, the sperm count, the sperm morphology, the motility. When we talk about motility, how fast the sperms move. And for a man to be able to impregnate a woman, the man needs to have a forward progressive motility of 42%. Now, some men, just like when you go for racing, some people are running, going towards the winning line. Some people are running, going to the opposite direction. That's what happens when you observe sperms in a microscope. So for a man to be able to impregnate a woman, one, you need to have a normal sperm count greater than 15 million. Two, you need to have a normal sperm volume greater than 1.5 mils. If it's less than 1.5 mils, you have what they call low sperm volume, which medically we call hypospermia. If it's less than 15 million sperm cells, they call it low sperm count oligospermia. If you're having low, your progressive motility is not up to 42% or it's less than 42%, no matter, even if you are meeting a girl of 18 years who just started, who is in a prime of reproductive age, you find it very difficult to impregnate that woman. And of course, normal forms, the normal forms of the sperms should be at least 4%. But you realize that a lot of men who smoke, who drink, having a lot of stress, take recreational drugs, when you analyze their sperms, their sperms are either azoospermia, which means there's absence of spermatozoa in their sperm. They have what they call necrosospermia, which means they actually produce the dead sperm cells. And the dead sperm cells, as a result of sexually transmitted infection that they neglected to treat, like chlamydia. They neglected to treat so many years back. And so when you take the sperm and analyze it in the lab, you realize they have what they call necrosospermia, which means all their sperm cells are dead. Or they have a mention of reduced motility, which is called astenosospermia. Astenosospermia. Or they have increase in morphology of the sperm. Either they have two heads or two tails, or the middle piece is missing, which medically we call tetrazospermia. So all these factors come together to cause male infertility. Another important factor why most of these men are increasingly suffering from infertility is a condition we call varicocele. Varicocele means the veins within the scrotum become inflamed and enlarged. And these veins, normally they were supposed to drain blood from the scrotum and send it back for oxygenation. But when these veins become enlarged and inflamed, they tend to disturb normal sexual function in the man. So you realize that at the end of the day, all these factors come together to cause the increased effect in male fertility we are witnessing now.
Okay. We have what we call erectile dysfunction and hormonal imbalance.
Yes.
That is for the men.
Yes. Now, when we talk about erectile dysfunction, we are simply talking where a man is unable, one, either is unable to have an erection, which we call primary erectile dysfunction, or two, the man is able to have an erection, but is unable to sustain the erection to a satisfactory level, which is called secondary erectile dysfunction. Now, most men who have an erection very well, within the process of making love, 1 minute or 2 minutes, they lose the erection. So many factors come into place to cause erectile dysfunction in men. One, stress. So many men are so stressed, they want to pay bills, they want to buy their girlfriend iPhone 16, they have this project to complete, they have school fees to pay and stuff like that. All these factors boil down to cause erectile dysfunction. Two, habitual use of sexual stimulants by the men. The other day I was watching news, and one guy was caught, was it in Yaoundé, selling tramadol to students in school. Most of these students, because they want to impress the girl or tell their friends that boy are strong, they go and take sexual stimulants. And in the long run, it tends to affect their ability to maintain erection. Another factor is masturbation. A lot of people shy away from this topic. Masturbation has therapeutic properties, and masturbation has negative effects. The therapeutic properties in masturbation is that it can be used to treat erectile dysfunction. However, indiscriminate masturbation in the long run can lead to erectile dysfunction. Also, increase in sugar levels. I've not said diabetes, increase in sugar levels. That's why I always discourage young men, I discourage people from excessive consumption of fizzy drinks. Take these sweet drinks in moderate amounts. A lot of people say, I don't drink alcohol, I'm a Christian. It's a very good thing. But these sweet drinks that you're taking, take them in moderate amounts, especially the young men, especially the men generally. Because consumption of these fizzy drinks in the long run tend to predispose you to hyperglycemia, which means you have higher than normal sugar levels. And when you have higher than normal sugar levels, the first thing it does is that it affects your ability to maintain an erection. That's why a lot of diabetic men, Mr. Leo, die very fast. Because the first aspect when a man has diabetes is that it affects the ability for the man to have an erection. And so the man is like, so this is my beautiful wife. I'm able to touch this my wife again. Those thoughts now you see lead the man to have hypertension. In less than no time, you see the man having stroke and the man dies. So hyperglycemia, stress, habitual use of sexual stimulants, use of recreational drugs like cocaine, tramadol, alcohol, excessive alcohol, smoking, all of these factors tend to cause either primary erectile dysfunction or secondary erectile dysfunction. But the good news is that all of them can be managed. How can it be managed? First, we need to know the cause, because in complementary and alternative medicine, where I belong, we do not treat by the symptoms. We first of all look for the root cause. So if we look for the root cause of your problem and we realize that probably it's coming from habitual use of those sexual stimulants, or maybe due to stress, or maybe due to increase in sugar levels, we'll make sure to normalize your system before giving you drugs that can make you have and sustain erection as you desire.
Okay. You talked in the beginning about so many young boys here, but so many girls are also into shisha consumption. Your revelations are also shocking. Many persons think that it's way better than the cigarettes that they smoke.
Yes. Let me just reveal. There's a program we are working on with the Southwest Youth, the Southwest League President, Mr. Kizito. We are trying to do all the paperwork to launch a project on free the air for Southwest. Now, shisha smoking, according to the World Health Organization, has a lot of effects. Primarily, I'll focus on the reproductive health area because that's where I belong. In women, it causes decrease in luteinizing hormone. And now, if there's a decrease in luteinizing hormone, these women start suffering from menstrual irregularities. If you meet most of those young girls smoking shisha actively every weekend, they realize that they always have menstrual irregularities. If their period is coming every month, the number of days will drop. If it was flowing for 3 days, it starts flowing for 2 days. If approximately they were using like 3 parts a day, you realize that the whole day, the part will not even get soaked. So that's one of the effects on shisha. 2, shisha smoking in women causes early menopause. Yes. We received a case the other day with my mentor, Dr. Eugene, and going back to the history of this girl is 28 years, but for the past 7 months, she has not seen her period, and she's having all the clinical signs, all the clinical menopausal signs at 28. So you realize that there's a lot of work that has to be done to struggle to reverse her system because she's already having decreased ovarian reserves. So shisha in women causes decreased ovarian reserves. It affects the anti-modulating hormone, the AMH, which causes what? Decrease in the quality of your eggs. So these young girls start facing difficulty to conceive. That's why I said in the beginning of the program, within the next 5 to 10 years, there will be a lot of increasing cases of infertility among young people because of lifestyle, because infertility doesn't just have medical factors. It has lifestyle and environmental factors. These 3 come into place to cause infertility.
Okay, so for those of you who take so much pleasure in smoking cigarettes and also consuming excessive shisha, probably impressing yourself and those around you, you've heard from the fertility expert who says that it's very, very risky and the future is not too rosy for our young people because a lot is going to be happening. And the sad side is that, okay, we are going to be accusing witchcraft, but these things also happen that you may not be able to impregnate a woman or conceive because of spiritual issues also.
Well, before I just answer that question, let me add something to shisha. According to recent studies published by the World Health Organization, by the European Society for Reproductive Medicine, smoking shisha for 1 hour is equivalent to smoking 100 sticks of cigarette. I want you to write it down. Which means if you go to the nightclub at 10 p.m. and you leave at 2 p.m., 4 hours, and you smoke shisha for that 4 hours, approximately means you have smoked 400 sticks of cigarette. Imagine doing that every week. In a month, if you go to the club 4 times a month, that's 1,600 sticks of cigarette times a year, times the number of years you have been smoking. So it becomes too saturated in your system, your quality of X are reducing just at a very young age. So
how does it affect the man?
It affects the man. I made mention in the beginning that shisha smoking has 18 carcinogenic agents present in it. That's why early 2020-2021, Minister Paul Atangaji placed a ban all over the national territory on the use of shisha. But Cameroon being the way it is, you realize that some people even have it in their homes now, and because the ports are very porous, it's still entering into the country. Shisha smoke causes thickening of the sperms. The sperms become too thick, and if the sperms become too thick, they are unable to swim through the cervical tract. And so most of the sperms, since the semen produced and everything is too thick, the sperms tend to die at the level of the cervix. They don't even swim to find their way up the reproductive tract, probably enter the uterus and swim right up to the fallopian tube, where is the site for fertilization. So primarily in men, shisha smoking causes thickening of the sperms. I made mention of the word viscosity. Viscosity measures how thick a substance is. And the sperms are not supposed to be too thick like pap. You know, just like pap. If pap is too thick, it looks unappetizing. If pap is too watery, it looks unappetizing. It's supposed to have a particular viscosity through which, when you present the pap to somebody, the person will say, oh, thank you for this pap. That's the same thing that happens to the sperms of a man.
Okay. Good evening, Mr. Leo. Please ask the doctor that anytime I want to see my menses, my underbelly pains me until I have to take injection, and I also lost appetite. What can be the cause?
Now, painful menstruation, we call it dysmenorrhea. It happens, some people it happens is, there's what they call genetic predisposition, which means your mother had it, you also have it. Almost everybody in the family has. What can be done is that there are non-pharmacological techniques that you can do if you are having menstrual cramps, which we call dysmenorrhea. 1, do moderate range in motion exercises. 2, use a warm towel and try to massage your lower abdomen. 3, make ginger tea. Ginger is even available in the market now in sachets that have already been prepared. You just have to boil and you filter and you drink, and immediately those cramps will be reduced. But if these non-pharmacological aspects don't yield any fruits, then the next thing is that, of course, there are over-the-counter non-steroidal anti-inflammatory drugs that you can take to help relieve your pains. You have paracetamol, you have diclofenac, you have ibuprofen, and all the rest. But dysmenorrhea, especially for those who are still growing up, is very normal.
Okay. Good evening to you all, and thanks for the program. Please, I wish to ask that I have been looking for a child for over 8 months now, and it is not going. I have a child getting to 3 years. Now, when I put to bed, I did family planning, and I don't know if it's because of the family planning or what.
Now, I think that we'll need to organize another session on family planning.
Okay.
Because there are a lot of myths and misconception about family planning. Madam, family planning does not cause infertility. Family planning, we have natural family planning methods and artificial family planning methods. For example, abstaining from sex is a family planning method. Why? Because you don't want to get pregnant when you're not yet ready. Now, artificial family planning method where you go to the hospital and they are giving probably Jadel, which lasts for 5 years, or you are giving maybe Depo-Provera or Cyanapres, which has an efficacy for 3 months, or you are giving barrier methods like condom, which is the male condom or the female condom, or you are giving combined oral contraceptive pills, tablets that you need to take orally every day. They do not cause infertility. If you have been trying to conceive for the past 6 months, please see a fertility doctor, see your gynecologist. 1, they will assess you to be sure that you are ovulating. 2, we'll make sure that during the ultrasound, they do you a pelvic or a transvaginal ultrasound. They also check for what? Endometrial receptivity. 3, they will check to be sure that your ovaries are not having any cyst in it, either ovarian cyst or polycystic ovarian syndrome. And also the level of the uterus will check to be sure that you are not having any uterine fibroid. We also check the acidity of the vagina. Realize that the vagina is slightly acidic, but most women, they tend to have increase in acidity of the vagina. They have increase in cervical hostility. All these things, if the cervix is too hostile and there's an increase in vaginal pH, they tend to kill all the swimmers. Just the quantity that pass to go up to the egg is reduced to fertilize the egg, so you tend to suffer from infertility. So the tail end is see a fertility doctor, see a gynecologist, and book for a consultation.
Okay. Good. Hello, Mr. Leo. Vertical is writing from Kumba. I like the program. Thank you very much. Good evening, Mr. Leo. Please, sorry for tabling my health challenge out of the topic of discussion. Please, I just want you to ask that if he knows any doctor he can recommend me. I'm suffering from sciatic nerve pain. James is writing from Macba. James, the Dr. Oben's number is on the screen. 673 573505. So that is his number. Write to him, please, directly. La femme peut tomber enceinte 11 heures de temps après ses menstrues, faire le sexe le matin et saigner le soir et tomber enceinte. Sandrine is writing from Douala. I don't know whether I understood the French.
Maybe you can help interpret so that we're able
La femme peut tomber enceinte 11 heures de temps après, that is 11 hours after menstruation. Can you get pregnant?
No,
Okay.
you cannot get pregnant. I made mention that the shortest menstrual cycle is 21 days. The longest is 35 days. Now, I said those who are having a 21 days menstrual cycle is very short. So they tend to ovulate immediately after their period, between the 7th day to the 10th day. Is there 11 hours?
11 hours.
No, you cannot ovulate 11 hours after menstruation because it takes time for the hormones to build and everything. That's why I have 3 to 5 days period. But those who are having a 21 days menstrual cycle, they have within 3 days for the stage of hormones to build and for the egg to mature and for it to be released. So it's not possible.
Okay. Somebody is saying that the penis is paining anytime it wants to urinate. Surely you have an ST. Is it STI?
Yes. Now, if you're having painful urination, which we call dysuria, 2 conditions are involved. 1, either you're having a urinary tract infection and the painful penis is due to inflammation of the urethra, which we call urethritis. The urethra is that pipe that conveys urine from the bladder to the exterior. So if you are feeling pain while urinating, please don't sit in the house and don't go and buy drugs. Go to the hospital. A test will be run on you. 1, urinalysis, your urine sample will be collected and analyzed in the lab. And 2, the doctor also requests for STI profile. It could be that you're having gonorrhea. So go to the hospital and seek for medical attention.
Okay. Go to the hospital, everybody, if you have these problems. Good evening, doctor. I'm Clara from Boya. We should find out if induced family planning from the hospital can cause cancer.
Come again.
Induced family planning from the hospital, can it cause cancer?
Now, what do you mean by induced family planning? Family planning is not induced. Family planning is voluntary. You go to the hospital and say, I don't want to get pregnant within this period. So, and they discuss the options with you.
Maybe they're talking about, is there an insertion?
Yes. Now, for the various, let's just talk briefly on that topic. For the various method of artificial family planning, we have the injectable, you have Cyana press and Depo-Provera, which lasts for 3 months. We have the implant, which is implanted the left upper arm, will last for 5 years. And we have the intrauterine contraceptive device inserted through the vagina, and it goes up. And we have the oral pills, which the woman has to take every day. And we also have the emergency contraceptive pills, which you take immediately after unprotected sex, or probably maybe through rape to prevent pregnancy. It doesn't have anything to do with cancer. You should understand that cancer happens when there is increased abnormal multiplication of cells. Your cells in the body they no longer respect the process of cell division. They give their own command and they respect it. Normally your body gives command that, listen, this body cells multiply by 10 times 5. Multiply 10 every day. But cancer cells come and give their different command and say, listen, this instead of multiplying 10 cells every day, multiply 50 cells per day. It has nothing to do with family planning.
Wow. Mr. Leo, good evening. Please ask the doctor what causes too much transparent discharges during foreplay.
Yes, transparent discharges is, which means the semen discharge is too watery. The first factor implicated is infection.
Okay.
Infection.
Okay. It's infection. Go to the hospital, meet a doctor. Good evening, Mr. Leo. I'm Innocent from Kumba. Please ask the doctor if it is normal that I make love with my wife, but after 2 to 3 days, the sperm will still come out even when she's pregnant.
Yes. This is one of the questions we answer every day. Semen leakage after making love is very normal. But what is actually leaking out is not actually the sperms, it's a fluid. The sperms, you cannot see the naked eyes. They are contained within the fluid that is being released. So it's very normal that some of the fluid will always leak out. It's very, very normal.
Okay, but it's just the fluid and not
not the sperms.
The sperm.
Because the woman is already pregnant. So if she was having a problem conceiving, would have said, okay, but it's fluid leaking after sex has nothing to do with infertility.
Good evening, Mr. Kum, and thanks for bringing this brilliant doctor on air. I must say I have been listening to health experts talk, but today in a different case, the Bohemian of the Benue watching from Garwa. Good evening to you, my brother. Greetings, Mr. Leo. I'm enjoying the program. Just to find out from the doctor if the cause of erectile dysfunction is hypoglycemia apart from lowering the blood glucose. Is there any drug to treat the erectile dysfunction? Hansen, writing from Kutaba.
Yes, Mr. Hansen. I did make mention of so many factors. I said stress. Now, the stress can be emotional, physical, or psychological. And also, like I said, other factors involved. We have hyperglycemia. But also, there are other conditions involved. For example, hypertension. So, apart from lowering the blood sugar levels, we need to be sure that all these other factors are kept at bay. When that is done, one, we can encourage diet. Diet itself plays a major role in restoring normal sexual function. And Mr. Leo, last time I mentioned that men should incorporate the use or the eating of watermelon at least 3 to 4 times a week. Now, watermelon is a natural Viagra. Viagra is a sexual stimulant. Watermelon is made of 70% water. When you incorporate the use of watermelon into your diet, on maybe bi-weekly, you realize that this, after visiting the hospital and drugs are given, if the cause has not been handled, the condition will come back. So apart from taking drugs, lifestyle modification also, engage in sports. Maybe you can register at the gym, or by yourself you can be doing Kegel exercises at home, few range motion exercises, and also diet, very important. Eat foods that are rich in antioxidants, eat foods that are rich in fiber, for example, bananas, tiger nuts, dates, nutmeg, watermelon, oranges, pineapple, ginger, garlic. These are foods that are very rich in vitamin C, in folate, in fiber, in zinc, and very rich in antioxidants.
Okay. We're looking at the reasons behind infertility, and we also understand that there is an emotional cause to infertility.
Excuse me. Right. Emotion negatively affects a man. Emotions drains the brain. That's why a woman who probably lost the husband within 1 week will look more pale than a patient who is just recovering from surgery. When you're having emotional stress, your body is focused to feed the brain, because when you're emotionally stressed, you realize that there's a lot of thinking going on in your head. You do 1,000 calculations within 1 minute. So every other bodily function is kept at bay, becomes stagnant. That is how emotions affect reproduction. And when you are stressed, most importantly emotionally, it leads to oxidative stress. Free radicals are released in the body. And when these free radicals are released in the body, it affects the reproductive system. And when this happens, you start suffering from infertility.
Okay. I want us to talk about breaking the stigma, cultural and social, societal pressure on couples to conceive. Could this also put extra pressure on the couples, and I don't know, they feel different? How do we overcome this?
Now, firstly, we need to excuse me, start with the sister-in-laws. Please, sister-in-laws, if your brother's wife is trying to conceive, please allow them go through their ordeal, and with their doctor and with the help of God, they will be able to conceive. Stop mocking at them. No two human beings are built exactly the same. And most of the time, the sister-in-laws, the brother-in-laws, the mother-in-laws, they mount excessive pressure on the woman. Meanwhile, the cause of the infertility is from their son and it's from their brother. Instead, what we should do is that we should support them emotionally, encourage them, tell them that, use real-life examples. I had a friend who was married for 10 years, and if she visited a doctor, and through prayers, you realize that the problem was resolved. Mr. Leo, last month I had received this woman I've been following up for the past 6 months, and when she complained that she's having lower abdominal pains, we requested for a pregnancy test, and behold, it was positive. This woman has been married for 8 years. After an ultrasound, he realized that she was pregnant for twins after 8 years, and she's 33 years old. And instead of her to be happy, she burst into tears. And when I asked her, Madam, why are you crying? This is something you should be happy. And she said the husband sent her packing 1 month ago, and now she's 1 month, 3 weeks pregnant, which means she was 1 month pregnant, but the husband did not know. And the pressure came from the family. Now, how do we break the news? I had to call the man, invited the man, spoke to him, and he apologized and said the pressure was too much from the sisters, and everybody was like, oh, the woman is barren and stuff after 8 years. So we are encouraging the relatives and the community at large. When you see a couple trying to conceive, encourage them, give them emotional support, pray for them, advise them to see a fertility specialist, advise them to see a gynecologist. By so doing, you are helping them to heal. By so doing, you are giving them that energy to know that, I have people who love you, who love me. And when they have that positive energy towards conceiving, due to emotional support from loved ones and family and friends, their journey becomes very, very short, and it makes the work lighter for us. Because according to my provost, Dr. Kwazem Olawale, he said a negative mindset of a patient is the greatest thing that can happen to a physician, because the patient has already said, oh, my hope is lost. No matter your expertise trying to give treatment, it will not work, because the person has already accepted within their brain that this condition, there is no way back. Just like the Mbororo community, they believe that for them to get well, you must give them drip, you must give them infusion, no matter, even if they are having a headache, you give them Paracet, and you give them what they call a placebo. A placebo is a medical solution which does not have any therapeutic effect in the body. You give them just an injection of containing just normal placebo, and you give them paracetamol. Because their brain has been functioned that they must take injection, they will get well thinking that it's the placebo, meanwhile it's the paracetamol that you give them. So dear community members, dear family members, dear sister-in-laws, emphasis on sister-in-laws and mother-in-laws, please encourage the wife of your son, the wife of your brother to go through their fertility journey in peace. That is my advice. Okay.
Yes. Why do we always overlook the infertility of men?
Well, the society has made it in such a way that it's only women that are infertile. Mm-hmm. But surprisingly, a lot of men live their lifestyle is more disorganized mm-hmm. than women. If you go to the bar and assess the number of men drinking, you realize that it's either you have 20 men as compared to 5 women. Mm-hmm. If you go to the quarters and you see a lot of people who are drunkards, you have 20 men and probably 1 or 2 women. But the women feel like this particular aspect is not normal. So the men tend to abuse it. And the society has, like I mentioned, has made it possible for it to look like only women have problems to conceive. And when a woman is trying to conceive, not going to start saying, oh, when she was young, she had numerous abortions. When she was young, she was living a promiscuous life and stuff like that. Forgetting that it takes 2 to tangle, and it takes 2 to produce a child. So the society should stop focusing on women alone. They should focus on the men, because men have, according to the European Union for Reproductive Medicine, the American College of Obstetrics and Gynecologists, the Canadian Society for Obstetrics and Gynecologists, men account up to 40% of cases of infertility. Men alone, 40% out of 100 men have 40% of cases of infertility. So it therefore means that women are not just involved in infertility, men are also involved. So the stigma around women should please stop. And that's why I'm always using the opportunity to encourage men to accompany their partners in the fertility journey.
Okay. How do we make this infertility issue not to be looked upon as a taboo in our community, so that people can freely discuss it and understand that, okay, this is also part of life? Yes.
Infertility issues or reproductive health issues should be incorporated into almost all spheres of life. Even in church, pastors should invite us and we'll come. Even in Marua, we'll come and have a normal session, because these topics are only being discussed in hospitals and probably in seminars. And in the seminars, it's the medical personnel themselves discussing the topics among themselves. Because when you invite the public, they don't come. So invite us to churches, invite us in your cultural groups, invite us in your Njangi meetings, the clergy is watching us. Invite us into your church programs and spare 1 hour. You can decide that this Sunday there's no sermon. Invite a gynecologist, invite a fertility doctor to discuss this topic. When more and more people are coming into your church, into your Njangi group, into your cultural group to discuss on infertility, you realize that it will become very normal for people to sit and say, hey, listen, I'm sorry from this issue. Do you know somebody that you can recommend? But since we are making it look like a taboo, these people tend to shy away when they are suffering from infertility, and most of them suffer in silence. And that's why our topic says the silent struggle navigating infertility in men and women, because so many men, so many women are suffering silently with infertility, but because we have made it look like a taboo, they cannot speak out. Okay, they cannot speak out. Let's look at the moving towards
slowly towards the end of tonight's edition of the program. Let's look at many persons are not being able to impregnate a woman, and women cannot conceive. How do we look for a solution to these problems?
Now, the solution first, let's start with the non-medical aspects. We have modification of lifestyle. If you go to the Ahuza community, the Mbororo community, the Akos, they are more fertile than us. We see them like they are suffering, but they are more fertile because they are not living a sedentary lifestyle. But us, we tend to see maybe frying food until the neighbors 5 doors, they get the aroma. It means you are living a very good life. So they see you eating bitter leaf, the other person you are suffering. No. We need to change our lifestyle, especially at the level of diet, because diet negatively affects our ability to conceive. Secondly, a lot of people are very inactive. For them to trek, for example, from my 1 to half mile in Limbe, they see themselves as suffering. But those moderate exercises, the World Health Organization recommends at least 30 minutes of exercise every day. But some people can go for months or years without actually trekking a distance of 5 minutes. The least distance they are on a bike, they tend to get a lot of weight. And like I said, weight gain causes increase in insulin insensitivity. And when there is increase in insulin insensitivity in the body, it tends to affect reproduction. So lifestyle and diet modification is very, very important. If you're having too much weight, please control your weight. If you're having low weight, excuse me, body mass index less than 18, it means you're having low weight. Body mass index greater than 30 means you're having excessive weight. Please control your weight. And now the other aspects, we have guided reproduction, which means you actually see your gynecologist, you actually see your fertility specialist to take you through the process of fertility through the use of drugs. Also, we have the other aspects where we have alternative therapies. Now, alternative therapies for infertility, we have acupressure massage for infertility, where we massage the abdominal cavity at the level of some particular acupressure points, one, to cause increased vascularization of the uterine cavity, to increase blood flow to the uterine cavity, to increase blood flow to the ovaries. And when that is done, your chance of conceiving will be high. Another alternative therapy is massage. Another alternative therapy is yoga. Another alternative therapy is herbal remedies. There are herbal remedies prescribed by the World Naturopathic Federation that have a lot of therapeutic properties when you are trying to conceive. For example, we have clove, we have cinnamon, we have guava leaves, we have bitter leaf, we have ginger, we have garlic, we have onions. These are foods that we see on a daily basis, but because we do not know that they can actually cure us from the infertility that we suffer from 10 years, we tend to neglect. And now when all of this is done and no result is forthcoming, we have the AROT, the assisted reproductive techniques. And the very first is IUI, intrauterine insemination, where the sperms are being collected from the man, watched, and the most active are being selected, and they are inserted directly into the uterine cavity of the woman through the use of a special catheter for them to be directly to go directly to the fallopian tubes, where is the site of fertilization, to fertilize the egg. If IUI fails, then the next step available is in vitro fertilization. And if that fails, in countries where surrogacy is legalized, then the next option available is surrogacy, or probably you go in for adoption.
What's surrogacy?
Now, surrogacy means you actually pay somebody to be pregnant, which means the egg is collected and fertilized and implanted into another woman.
How? I don't understand.
Now, this is where reproductive medicine comes into place. Now, countries like US, South Africa, and other advanced countries where reproductive medicine is actually very advanced, surrogacy is actually very common. You pay somebody and your egg is being released, removed, fertilized, and then implanted into that person.
Fertilized with who? With what?
From this, your egg is released, collected, the man's sperms are collected, fertilize the egg in a special chamber, and the fertilized egg is implanted into the woman, the surrogate mother. And she carries the pregnancy to term under a written agreement. And when the child is born, she hands over the child to you.
Okay.
Yes, that's what happens.
Good evening, Doctor. I'm enjoying your program. Please, how can we treat a woman with frequent embryonic pregnancy? Emma is writing from Idea.
Hormonal tests. Do a complete hormonal profile. One, you need to check your prolactin levels, progesterone, estradiol, follicle stimulating hormone, luteinizing hormone. When this is done, you will look at where the problem is coming from. And also, a transvaginal ultrasound will rule out if there is poor endometrial receptivity or not. So these are things that need to be done to be able to make sure that such conditions are avoided. Okay.
Good evening, Mr. Liu and the doctor. I'm Cynthia, writing from Yaoundé. I have sexual infections, that is syphilis and chlamydia. I have been taking drugs and herbs, but could not avail. Please, what should I do? And also, I have persistent discharges, and my menstrual cycle does not follow the date.
Now, last time when we were invited on air, I said the fact that your menstrual cycle is not following a particular date, it doesn't mean that you are having menstrual irregularities. For you to know that you have a regular menstrual cycle, please count your cycle for the past 6 months or for 6 months. We are in November. If you have already seen your period in November, this is the 11th month. Count your period right up to June. Add the values that you have. For example, if between October to November, you count and it gives you 28 days, you write 28 days, it means October to November, it took your cycle 28 days for it to come. October to September, you count, if it gives you 27, you write plus 27. To August, maybe 26, you write plus 26, do it for 6 months. Sum up the values that you have and divide by 6. The number that it will give you, that is the average of your menstrual cycle. Your menstrual cycle might come this month, your period might come this month on the 5th, and comes again on the 23rd, or comes again on the 28th. It simply means that for that month, you have a menstrual cycle of 23 days. It doesn't mean because your period came on the 1st of the month and comes again on the 27th, it means that it's irregular cycle. No. If it comes, for example, on the 1st, and today is the 25th, your period comes again on the 25th, it means that for the month of September or November, you're having a 24 days menstrual cycle, and your possible ovulation day is the 9th. That's what it means.
Okay, I hope somebody has learned something this evening. But she says she had this, and she's taking drugs. I don't know whether she got prescriptions from the hospital. She says she has taken drugs and herbs.
Now, if most, Mr. Leo, the thing is, Cameroonians have a very poor health-seeking behavior. Most of them will not want to spend on their health. When they go back, when they come to the hospital and you give them rendezvous, they don't come back. Because if you have seen your doctor and he has given you drugs to remedy the situation, and you realize that the condition has not improved, go back and further assessment. That's why in the hospital they give you rendezvous. Rendezvous means follow-up visit. Go back to the hospital and see your doctor to be able to rule out the possible cause of the problem.
Okay, somebody is asking for, hello Mr. Liu, very enriching program, please for his contact. You want Dr. Oben's number. The number is on your screen, just take it down. The number is 673-573505. That's the number on the screen. That's Dr. Oben's number. Just get it and you can write to him after the program. I'll take 1 or 2 of the worries expressed by those watching us, and then Mr. Leo, good evening. Thanks for this beautiful topic of our discussion and for inviting such a brilliant doctor to clarify us on certain health issues. How can a couple conceive a girl child? Prince Equa is writing from Limbe.
All right, Prince, I made mention of the fact that it's much easier to conceive, in fact, sex determination generally. But the most important thing is that I'm in Limbe, you collect my number, you book for a consultation, and I'm going to give you a detailed explanation on how to conceive of a girl child. But the first thing, we need to know the menstrual cycle of your wife. And there are some things that she has to avoid eating during ovulation to increase the chance of having a girl child.
Okay. Good evening, doctor. I'm Mariana from Tico. Please, why is it that when a man and women are having sex, then the lady is feeling a sharp pain under her stomach?
Now, pain during sex, which we call dyspareunia, is one, probably due to vaginal dryness. But if you are feeling lower abdominal pain during sexual activity, primarily indicates that you're having chlamydia. If you are feeling lower, as a woman watching us out there, if you are having lower abdominal pain during or after sex, it simply means you are having chlamydia. So you and your partner should go to the hospital and get checked for chlamydia.
Okay. Good evening, Mr. Please ask the doctor about a woman who has irregular menstruation. What is her fertilizer day? Mr. Elvis is writing from Bamenda.
Mr. Elvis, when you say irregular menstruation, I just explained earlier that for us to be sure that you're having irregular menstruation, one, your menstrual cycle should be less than 21 days or should be greater than 40 days. If your menstrual cycle or the menstrual cycle, because Elvis is a man, if the menstrual cycle of your partner falls between 21 days and 35 days, the menstruation is not irregular. What you just have to do is that take a pen and paper, ask her, Mama, this November, have you seen your period? Yes, you write it down. October, when did you see your period? You write it down. Take out all of those dates and divide by 6. Add the numbers and divide by 6. It's going to tell you if she's having a regular cycle or not.
Okay. Good evening, Doc. Please, is there any medication for penis enlargement? But for this, is there also a repercussion? Because I see on social media lots and lots of medications being advertised.
Yes. Those even advertising the penis enlargement, none of them is a medical personnel.
Okay.
And I will not want to spoil someone's business, but let's be clear. The size and shape of a man's penis is determined from birth, and to a certain extent, the nature of circumcision. Most guys who are poorly circumcised, they tend to have a poor size of the penis. And so, taking penis enlargement creams and pills will not cause your penis to be enlarged. Most of the times, these things are aphrodisiac, which means they just tend to increase your sexual appetite, and you realize that for erection to happen, there is increased blood flow to the erectile tissue, and if there's an increase in erectile tissue, the penis becomes elongated and hard, and they now see it as if there is an increase in the size of penis. No. For you to know if the penis is actually increasing in size is when it's flaccid, which is not erected. So the honest review is most of those things do not work, and in the long run, most of them are linked to skin cancer because, one, they are not certified by dermatologists. Two, sexual and reproductive health experts cannot ascertain the active ingredients present in those sex enhancement pills. I understand it's business for some people, but if you visit me and say you need penis enhancement pills, I will tell you they do not work.
Okay. Doctor, merci pour vos conseils. More blessing in Jesus' name. Sandrine is watching us from Douala. Bonsoir, Sandrine. Please, doctor, after miscarriage, the continuous flow can still be considered as normal menstrual flow?
No, after a miscarriage, a uterine revision has to be done, which means the doctor or the midwife, if it's at the level of the health center, at the level of the hospital in town where you have a gynecologist, a uterine revision has to be done to ensure that there are no particles or product of conception left. And after that, within a week or so, you'll be able to see a normal menstrual period. But if it extends after 7 days, which we call pathological menorrhagia, you need to go back to the hospital for the case to be reviewed. Maybe after the menstruation, you have what they call uterine atony, which means your uterus failed to contract to go back to a non-pregnancy state. And if the uterus fails to contract, you have that prolonged bleeding after a menstruation. You need to go back to the hospital. Or you have a decreased coagulopathy, which means your blood, the coagulating system in your blood tend to reduce after the menstruation. After the miscarriage, you need to go back to the hospital where you had the miscarriage and cleaning was done for the doctor to probably assess the case.
Okay, good evening. All in the studio. I just, you recent, please ask the doctor, how about those who at 19, 20 without involving themselves in sexual activity? What can happen when they are married in the days ahead? It's Mr. Dipo writing from Menda.
That's a natural family planning method you are doing. It's called abstinence. It doesn't have any effect.
Okay. Good evening, Mr. Leo. Please, I wish to ask the doctor how to get a woman pregnant of a girl child. Mr. Ngome is writing from Bangem. He explained that already. The male sperm.
Yes, I said this is a third person that's asking. Now, I said the male sperms, they swim very fast, but they do not have resistance. And now, you need to master the menstrual cycle of your partner, because no matter how much we explain, if you do not master the menstrual cycle of your partner to know the length, you realize that you'll be falling on, all our words will be falling on a rocky ground. Now, if you want a girl child, this is what you should do. If the lady is having a 28 days menstrual cycle, how do you know she has a 28 days menstrual cycle? Count from when the period came previously to when she's having it now. If it's 28 days, it means she's having a 28 days menstrual cycle. But to draw that conclusion, count her period for the last 6 months, add up the values and divide by 6. The value it gives you, that's the length of her menstrual cycle. Let's say after that is done, you realize that your partner is having, let's say 30 days menstrual cycle. If she's having a 30-day menstrual cycle, our predicted ovulation day is on the 16th, which means if on the 1st of November she starts seeing her period and she's having a 30-day menstrual cycle, on the 16th of November, she's ovulating. If you want to have a girl child, emphasis on girl child, it means that you meet with your partner from the 13th and 14th. You meet the 12th, the 13th, and the 14th. You do not meet on the 15th and on the 16th. If you meet on the 15th and the 16th, it will result to a boy child. Why? Because the male sperm swim very fast. If you meet on the 12th and on the 13th, before the 16th day, 80% of the male sperms would have died. And the female sperms, since they swim slowly, but they have a lot of resilience, they will be able to meet the egg and fertilize the egg. But also, during the course of ovulation, there are some fruits that the woman is not supposed to eat. One, the woman is not supposed to eat fruits that are high in citric acid. For example, stuff like pineapple, oranges. Pineapple and oranges. If you desire a girl child, do not eat fruits that are high in citric acid like watermelon, pineapple, and all the rest. But if you desire by the boy child, those are things that you're supposed to eat. So these are small differences that come into place for sex determination.
Good evening to you, Mr. Leo. Please help ask the doctor, since I am making love with my wife, I have never gone more than 2 rounds. What could be the problem?
Now, sexual satisfaction is personalized. But I do not know if maybe you cannot go more than 2 rounds because you are suffering from erectile dysfunction or premature ejaculation. So maybe you should rephrase the question. If we have time, we can take it. But if it's that you're having premature ejaculation, which means you ejaculate very fast, and then you have erectile dysfunction coupled with, you have premature ejaculation coupled with erectile dysfunction, which means you ejaculate very fast, but you find it difficult to maintain and sustain another erection, please visit the hospital. We have to review the cause of the premature ejaculation. We have to review the cause of the erectile dysfunction, because after you ejaculate, biologically, after 30 minutes, you're supposed to have another erection, 30 minutes. But due to some factors, maybe you came back from work tired, 2 hours. If after 2 hours you're unable to have erection after discharging, after ejaculating, you're having erectile dysfunction, and that cannot be treated at home. See a fertility doctor, see an expert.
Okay. Good evening, doc. Please, is there any medication for penis enlargement? He has answered that there is none. You may just be deceived here. This one says, good evening, Mr. Leo. The program is very enriching. Please, I have been having irregular menses for a while now, and I've been unable to conceive since March 2024. How do I go about this? Sorry, I have not been able to conceive since March. Okay, Maxeline is writing from Kumba. I think
we answered that.
Yes, they should just get to you directly. Good evening, Mr. Liu. My wife's vagina is too wide. What can be done to remedy this situation? Yes.
Now, when the vaginal muscles lose their elasticity, one at times is as a result of the build-up of the vaginal muscles. But the good news is that with the help of massage, with the help of Kegel exercises, which is a particular exercise that have been done to train the pelvic floor, you realize that the vaginal muscles tend to constrict. Please advise your wife not to go in for what they call vaginal tightening. It doesn't work. See your gynecologist, book an appointment with me, and we're going to do massage. We're going to help massage the pelvic floor muscles. And when that happens, the vaginal muscles tend to contract to a comfortable state. But understand that every woman is built differently.
Okay. Good evening, Mr. Leo. It's Vanessa from Yaoundé. I always have vagina itches when my period is around, and after with smelling discharges. What can be the cause?
You have an infection.
Okay.
If the discharges are not naturally, the vagina, they call it self-cleansing. It always releases discharges. But if the discharges come with an offensive smell, it means you have an infection. So go in probably for a vaginal smear, where your vaginal sample will be collected and analyzed in the lab to probably check for the possible cause of the infection, of the itches that you're having, and the offensive discharges.
Okay, good evening, doctor. I'm Eric from Tombe. Please, is it advisable to have sex during early stage of pregnancy?
Yes and no. Now, yes, in the sense that sex during pregnancy, the advantage is that it creates a bond between the father and the unborn child. Sex during pregnancy causes the release of the love hormone oxytocin. And oxytocin is that hormone that is needed when the woman wants to deliver. So if you are constantly having constantly having sex with your wife, there's a build up with that hormones. And so when labor starts in pop, you realize that the woman delivers. But now, if the woman is having what they call high risk pregnancy as certified by the doctor, you struggle as much as possible to avoid sex, especially in the first trimester. High risk pregnancy means, for example, this woman is having a threatened, we call it a threatened abortion. All right, the pregnancy is threatening to come out. What people call miscarriage, we call it a threatened abortion, especially in the very early stages. This woman is sick. This woman is either having malaria in early pregnancy, anemia in early pregnancy, hyperemesis gravidarum, which means excessive vomiting in early pregnancy. Please try as much as possible to avoid sex in the first trimester. But if the doctor has classified her fit, you can go ahead with your sexual activity.
Good evening, Mr. Lou. Thanks for the brilliant doctor. For me, I have learned a lot. Chair Cletus is writing from Suza. Good evening to you, Chair. This one says, good evening, Mr. Leo. Please ask the doctor that anytime I want to see my menses, my underbelly pains until I have to. Okay, I'm sure you asked.
We answered that already.
Yes. What can be the treatment for gastric ulcer? Hello, doctor. Good evening. My name is Favor, and I am writing from Boya. Please, I wish to ask, is it normal for a lady to feel pains on the day of ovulation? Thank you very much, doctor, for your response. Yep.
Ovulation pain is very normal. Those are some of the symptoms. I made mention of the symptoms of ovulation. One is mild lower abdominal pain, either from the right, if it's the right ovary that is releasing an egg that month, or from the left. It's very, very normal. Another signs that some people will have, you have increase in sexual appetite, your breast becomes painful, your nipples become tender to touch, and the areola, the black area around your nipples, you realize that it becomes shiny. Most women will not notice it. For you to actually know they are actually ovulating, take note of these symptoms. We have one, the appearance of clear egg-white vaginal discharge and it's very slippery. 2, mild low abdominal pain. 3, increase in body temperature, mostly towards the evenings. 4, increase in the taste of smell. You can enter the house immediately and say, oh, there's something is wrong somewhere here. Increase in the sense of taste. The least amount of salt in food, you easily pick it during your ovulation because of hormonal activity. And I said you have increase in the size of your breast engorgement, you have painful nipples, and you have a shiny appearance at the level of the areola. The black area around the nipple, we call it the areola. Those are some of the signs that you have to look out for during ovulation.
I'm 42 years. Can I still get pregnant with high prolactin? Mirabel is writing from Douala.
Yes, Mirabel, you can get pregnant even at 42 with high prolactin levels if the right thing is being done to rule out the cause of the high prolactin levels and the high prolactin levels are brought down to the normal levels.
Good evening, sir. Is it advisable to make love to a breastfeeding mother? And yeah.
Yes. The same question I received the other day from 2 breastfeeding mothers, and they were like, for the past 2 months, I've been refusing sex from my partner because I'm breastfeeding. Now, the idea that our people say in pidgin, sex is spoiled picking Bobby is very wrong. It's a myth. It has nothing to do with love during sex while the woman is breastfeeding. Has nothing to do with breast milk production, please. It has nothing to do. Sex releases a lot of hormones, dopamine, you feel happy. It causes the woman to feel happy. Oxytocin and all the rest. And sex is a stress reliever in both men and in women, especially in men. So, dear breastfeeding mother, do not deny your partner the sexual pleasure because you are breastfeeding. It is not advisable, please. Okay.
Good evening, all in the studio. Please, Mr. Kum, can you ask Dr. Oben how long it would take for a woman, how a woman take after delivery before seeing her menses? Mr. Nkem is writing from Yaoundé.
Now, it generally depends on the genetic makeup of this individual. One, if you are carrying out what they call exclusive breastfeeding, which means you are giving your child just breast milk, no artificial, no water, no food, it can take you 6 months. And at that process, we are having what they call lactational amenorrhea, which means you are not able to see your period because you are breastfeeding. However, because of the genetic makeup of some people and they have high hormonal activities, 3 months and their periods already resume. Some people 1 year until they win the child before it generally resumes. So there's no particular formula. It generally depends on the genetic makeup of that particular individual.
Good evening, Mr. Leo. Mr. Peter from Malindi. My wife put to bed a set of twins babies 2 years ago. The breast milk are still flowing. What can be the cause?
Yes, hyperprolactin levels. Medically, we call it galacturia, which means your breast milk is still flowing and is due to high prolactin levels. Please visit a fertility specialist, visit a gynecologist, and drugs will be given to suppress the activities of prolactin and the breast milk will flow. Please do it immediately because when you allow the levels to continue to increase, she will face difficulty to have another child if you guys desire another child.
Good evening, Mr. Leo and Dr. Euphrasia from Kumba. Please, I want to ask my sister who is 17 years old. During her menstrual period, she flows heavily and almost 2 weeks to an extent that the doctor has to transfuse her blood. Doc, please, what could be the cause?
Now, excessive menstrual flow, polymenorrhea, is a very big problem. Now, they have given her transfusion. That's a symptom that they have treated. You have to ascertain the cause of the excessive menstrual flow. Dear young ladies, if you use more than 3 parts a day, maximum 4 parts a day, please see your doctor. If your menses flows greater than 7 days, your period should last between 3 days to 7 days. If it flows more than 7 days, you're having a condition we call pathological menorrhagia. Please see a doctor. It could be that one, most factors implicated for excessive menstrual flow is uterine fibroid and polycystic ovarian syndrome. So it could be that at this very early stage, either she's having hormonal imbalance or she's having a uterine fibroid.
Okay. Good evening, Mr. Leo is High Center watching from Douala. Please, Why do I feel tired after sexual intercourse with my husband?
Well,
it's an exercise now.
Yes. Sexual and reproductive health experts say the amount of energy lost during sex is equivalent to running 10 times a football field. Let me take it again. The amount of energy lost during sex is equivalent to running 10 times a football field. So I hope you now understand why you're tired, especially when the sex is prolonged.
Doctor, good evening. I made love with my wife for close to an hour, but she had never discharged. Please help me. Agbo is writing from where?
Now, Mr. Agbo, is not prolonged sex will not cause the woman to discharge. First, every woman has a soft spot. Identify a soft spot. Talk. There's what we call sex therapy, sex talking. Sex talking means before actually involved in the act of vaginal penetration, ask your wife, please, which area in your body excites you the most? But most of the times, after kissing, poop, you push your woman into the bed and you're already penetrating to her. No. Before talking, even before going to the house, text her on phone. Initiate sex talking on phone. Before you even get to that, you realize that your woman is already discharging, even without you being around. So sex talking is very, very important. Foul play, excessive foul play is very, very important before vaginal penetration. If you follow these tips, or you can get my number on the screen and write me, and I'm going to give you an exclusive consultation and tell you tips that can be followed to make sure that your woman experiences what you're looking for.
Good evening, doctor. How often should a couple have sex? Like how many times weekly? Secondly, what's the average time for an ejaculation to occur during sex? Terence Boya.
Now, the first question is as much as you guys desire. As much as you guys desire. In as much as urologists say a man needs to have sex at least 21 times a month to prevent prostate cancer in the old stages, in the old ages, we realize that due to your work pressure and every other thing, you will not be able to meet up with those times. So if you are married, there is no restriction, there is no number of times, there is no prescription. The only time we prescribe sex for couples is when they are actually trying to get pregnant. That's when we prescribe sex, that have sex this number of times. But if you are not trying to conceive, as many times as possible. And your second question is, there is no particular time for you to ejaculate. However, if you ejaculate less than 1 minute, it means you are suffering from a condition we call intravaginal ejaculatory latency time. But however, if you ejaculate more than 2 minutes, it means it's normal. Ejaculation less than 1 minute means you are suffering from premature ejaculation in a condition called intravaginal ejaculatory latency time. If it's greater than 2 minutes, it's normal ejaculation.
Okay. Good evening, doctor. Please, I wish to ask if there is any sign one can know if the wife is pregnant with a baby boy without going ecography.
No, go and do ecography. There is no sign. Go and do ecography. Do ecography at 22 weeks. At exactly 22 weeks, when you do an ecography, the sonographer has 80%, 85% chances of telling you that it's a boy child. But most of the times, you want to send your wife to the hospital, she's already 32 weeks pregnant. The sonographer has limited chances because the baby has already filled the entire uterine cavity. But if you come at exactly 20 weeks or 22 weeks, maximum 24 weeks, the baby has not completely occupied the uterine cavity, the sonographer has at least 85% chance of telling you that this baby is a boy and becomes out a boy.
Good evening, Mr. Leo. Please, I had gonorrhea and was partially treated. Since then, my sperm is yellowish in color and light. Please help me ask the doctor if I can still impregnate a lady.
Well, I cannot say you will be able to impregnate a lady without seeing your semen analysis. So if you had gonorrhea that was partially treated, go in for a semen analysis and go back to the lab to have a culture done. Now the lab results will indicate if you have leukospemia, which means you have increase in white blood cells in your sperms. And also the color of your sperms will determine microscopically if it's normal or not. When I see your semen results, I'll be able to tell you if you're able to impregnate a woman or not. But with your naked eyes, you'll not be able to know.
Good evening to you in the studio. Please, Mr. Leo, ask the doctor that if one has followed the sex determination method he has explained but keeps giving birth to the same-sex children, then what can be done? Enunciata, writing from Bamenda.
Enunciata, the sex of a child is determined by the man and not the woman. And that's why I said previously that the men should have a mastery of the menstrual cycle of their woman. Like I said, sex determination is 78% possible. The remaining 22% is for nature. So there's a mistake somewhere. You have to go back to the drawing boards. And don't do it alone. Seek the services of a fertility specialist. Get my number, call me, book an appointment, and we'll do it down and realize that your next child is going to be a girl.
Okay. We want to thank you, Doctor, for accepting to come and talk to our audience tonight.
Oh, it's actually a pleasure when we are called out to educate the population on fertility issues.
Thank you all for watching, and to you, Desmond and Eli, for production. Stay blessed. Bye-bye.